Hi, I'm Dr. Adatone Musa.
Hi, I'm Dr. Hussein Musa.
I'm a board-certified epileptologist and neurologist.
I'm a certified Best Husband of the Year, Best Father of the Year,
Yeah.
and future Dad of America.
Dad of America.
Yeah, it's a lofty goal, but I think I can do it.
I think you're preparing people for Father's Day, right?
Yeah.
Yeah.
You know, mothers, they get all the good stuff. Dads, we get a tie. Our kids may even remember it. Maybe I need some healing.
I think those certifications are way more important than anything that we've talked about. So
Yeah.
that's awesome. I love it. Today, we're going to talk about how direct care addresses gaps in care for patients, which can be really frustrating.
Now, why are we talking about direct care on Healing Talks?
Well, because it's a new practice model, and this new practice model increases access to physicians for patients. It increases access to general health care, to primary care, and also to specialty care. That reduces complications down the road, and overall, it just improves the quality of life for the patient.
Yes. One thing that I recently heard, in direct care models, you have doctors and patients working toward the same goal, to keep you healthy.
Yes.
In our current model, if you notice, the doctor has to give you a list of diagnoses. You'll see some strange numbers on your bill, and the more diagnoses, the more treatments they give you. The sicker you are, the more treatments the doctor can give you. Unfortunately, it leads to more revenue. So we have this healthcare system that actually benefits and generates revenue when you're sick, versus direct care. We're trying to do our best to keep you healthy so you don't need to go to the hospital.
Absolutely. This is called preventative care. And in our prior episode, we talked about how preventative care addresses gaps in care in pregnant women who have epilepsy, who are on anti-seizure medications and really need close monitoring. So with this model, we'll be able to see women more frequently, at least every month, monitor their drug levels, counsel the patients, make sure that they're on the right medications that are not harming the fetus, look into not only drug levels, but any sort of side effects, monitor for injuries, prevention of injuries, so that they can have a full-term delivery, God willing, with no complications from the seizures or the medications.
Amen.
Yeah.
Now, are seizures, or even first-time seizures, does that occur in pregnancy?
Oh, yes, it does. So it depends from patient to patient. Everything is individualized. But for some patients, if they're on medications, they have pretty good control of their seizures on a particular regimen. They get pregnant, their metabolism changes. So that means on a molecular level that their body will break down the anti-seizure medications that are controlling the seizures, and they have more seizures.
Okay. So let's say if you're a patient, you have a neurologist, you get pregnant, but it may take 3 months to see
a neurologist.
Yeah.
So 3 months is too long in this patient population. And so what might happen is that the seizure frequency, the number of seizures might increase because the body continues to break down the necessary anti-seizure med levels. And, they might end up going to the emergency department, God forbid, falling during pregnancy. That can cause a lot of other complications as well.
Well, I think at least this direct care model for women who have known epilepsy or who have a first-time seizure, it may just be a lot easier to contact a direct care neurologist, get seen the next day,
quickly,
start a workup, and work with them during this pregnancy. And maybe after pregnancy, they don't have to worry about it. But even if they do, they have somebody they can follow up with.
Right. Now, even after pregnancy, you still need close monitoring because your body is slowly getting back to normal metabolism-wise. So you'd still have to get those monthly checks of drug levels until everything stabilizes and we are able to get a new dose for that patient or determine a new dose of medications.
This sounds very complex, and it would be great to have time for your physician to explain it.
Absolutely. So we'll continue on our next episode.
Thank you. Visit us at kingdomdocs.com.
Bye-bye.